The clinical problem that we wanted to address with this research is called orthostatic hypotension. So it has to do with low blood pressure. When a person is standing up and staying completely still, gravity pulls, his blood towards his feet. And if he doesn't do anything about that, it just sort of stays there. Over time, if that's not rectified, not enough blood's gonna go to his brain. You can start to get symptoms of hypoperfusion, so not enough blood in the brain. The brain's not getting enough oxygen and nutrients. This is especially a problem for people who have spinal cord injury because their body's ability to regulate blood pressure is impaired. It can keep a person sort of bedbound, right, or bedridden, and can lead to a lot of problematic secondary complications. In our research, we wanted to see if we could come up with effective intervention against that. So we combine what's called functional electrical stimulation. So we apply electrical stimulation to the leg muscles, and this stimulation makes the muscles contract. So we wanted to combine this with passive movements of the legs, meaning that the movements are not induced by the person, but it's being induced by something else. And in our case, we had this tilt table, and the device also has the ability to move the legs of the participant. The movements and the muscle contractions that the stimulation induces, they work together to push the blood toward the heart of the person while the person is being kept in a standing position. And so that, we have a lot of flexibility to make our therapy basically sort of customizable for each person, yeah. You should be willing to invest your life in something without the prospect of your name being on something. I always see research as something sort of maybe more selfless, but people will say that I'm idealistic. But I don't know. I don't know if I want to lose that, because I think you have to have some ideals and principles. Yeah. So I'm not ashamed of it, but